Hi everyone, Courtney here with Bionic Blaze clothing. I'm a 2-time cancer survivor and amputee. Before I started driving, I wanted to show you all the scars that I'm going to be talking about. So today we're going to be talking about ports and Port-A-Caths. So I have this first scar here. It's pretty hard to see. This is my very first scar that I had that had a Picc line in it. So it got put in this side. And then the other side, I got a Port-A-Cath, which actually went underneath the skin. So this is the scar that I have from it. Now that we've gotten that out of the way, I wanted to talk about the Picc lines and the Port-A-Caths, their uses, their risks, their pluses and minuses, everything that you need to know about Port-A-Caths and Picc lines. So the very first time that I had cancer, I was 18. I was working with pediatric oncologists, so they were used to working with children essentially. Because I had a childhood cancer, they're gonna have the most expertise in the kind of cancer that I had. Because I was going to be doing such long treatments and some of the chemotherapy was really, really harsh, they recommended that I get what is called a Picc line. And it's a type of catheter that goes into your chest and you have a tube actually sticking out of your chest. It was about this long. So the main reason why they have it like that is for ease in a lot of different ways. So there are some instances where, like with methotrexate, you really don't want that touching your skin in any way. There are other ways to kind of avoid that, obviously, but this was probably the best way to do it. Another plus with it is you could actually draw your own blood with the Picc line because it has a tube sticking out, and you essentially have the syringes without the needle that you clean off the end of your tube, you clean off the syringe, or you have a sterile syringe, obviously. You flush it with saline, and then you drop your own blood. That prevents the person from having to go to the hospital to get their blood drawn. You have to get your blood drawn the week before you get chemotherapy because they need to make sure that your blood levels are good. So it was really great. I was able to just draw my own blood, give it to my parents, and then they would go to the hospital and drop my blood off. So super easy, made that really simple. That was probably one of the biggest pluses for having the Picc line. Now, most of the time, the Picc line is supposed to be put in your right side, but I had a really bad experience with it, essentially. It was the first day of chemo. They wanted to do the Picc line, and then they wanted to start chemo immediately because they want to make sure that they can get to the cancer as soon as they possibly can. So my surgery for the Picc line was actually pretty late in the evening. I had some of the younger surgeons. They seemed very sure of themselves, which came to prove to be a problem. Essentially, when you sign off on any surgery, there's going to be some sort of risks, and one of the risks for getting a Picc line or a Port-A-Cath is the chance of your lung collapsing. So they're supposed to put it in your right hand side, and essentially what they're doing is they are putting this tube in to directly insert into your vena cava. You're directly pulling blood from a huge vein, and I think that the right side is better for some reason. I'm not totally sure why. When I woke up, I saw I had a ton of little poke holes here, so they tried multiple times, obviously on this side. They ended up doing it on this side because they were having too hard of a time doing that. But in the meantime, when they were doing that, they actually punctured my lung. I woke up from the surgery. I felt okay. You know, surgery is hard. I had the port. They started chemo. And then I started to feel this clicking sound, and it was like the feeling of clicking on your insides. It was really weird whenever I would breathe. So I said, hey, I need to talk to someone. I'm feeling this clicking. The doctor came in and said, oh no, you're fine. But then someone brought an x-ray machine, and we were like, oh, well, the doctor said it was fine. And so then we didn't do the x-ray because we didn't want more radiation. And then my lung collapsed. It didn't collapse right away. It collapsed probably hours later. But my lung collapsed. So I'm in the midst of all of this, and I don't remember much of it. I've asked my parents over time, so I stopped breathing. It's a huge problem. They had everyone run in, and they had to take me back into the surgery, the OR, in order to get my lung inflated again. And I kind of remember hearing certain things. There are a lot of people that will kind of tell you that they remember what the doctor said as they were under, and at the times that I have been under, I remember certain things. I remember certain things being said, and one of them was, oh, she's doing chemo right now? We're doing this while she's still getting chemo put into her body? This is crazy. So I remember them saying that. So essentially what happens when your lung collapses is you cut into a certain part of your rib, and they put this thick plastic tubing, they literally shove it in between your rib cages in order to reinflate the lung. You have to have that in for a couple of days. I think I had cisplatin the first time. My lung collapsed. I just had surgery twice, and now I have this tube sticking out of me, so I can't leave my bed because I'm stuck to all these different contraptions. And they leave the chest tube in for a couple days to make sure that your lung stays inflated. And I will tell you that getting that chest tube pulled out is one of the worst feelings you'll ever feel, because you can feel it pulling out of between your rib cages. So you can feel all of that. It feels really terrible. The feeling is the worst because you can just feel the edges of the plastic coming out. It's bad. I had to do all that. That was a very dramatic it's a very dramatic way to introduce myself into chemotherapy. So that essentially is the Picc line catheter, and it's kind of a pain. You're not really supposed to get it wet. You constantly have to clean it. You constantly have to have dressing on top of it. So they have this like clear plastic tape that they'll put over it that works on it, and then they kind of put extra stuff around it in order to keep it from coming off. And then when you do take it off to clean it, you have to put a mask on. You wear gloves and wash your hands and clean everything and just like get under everything, because it's essentially an open wound. It's just a tube sticking out of your skin. So there's no way for it to heal, so you have to constantly make sure that it stays clean. The other thing that you also have to do is push heparin through it daily, because you want to make sure that it doesn't get clogged, and you also don't want to have any blood clots go through your bloodstream, because that can cause problems. Blood clots are not good to be floating around in your body, so you have to do heparin fairly often. I can't remember if it was once a day or twice a day. And when you're doing the blood, like taking your own blood, it works great. And then when you're in the hospital getting chemotherapy, it's super easy because they don't have to stick you. So I had that for the whole year that I was going through chemo and everything, and I couldn't take a bath. Taking a shower was a pain because you have to keep it dry. And so it's just like showering kind of sucks the whole time that you have it, and not being able to immerse it underwater because you don't want it to get infected. Lots of things going on with all that. So once I was finally done with everything, I never had any complications. I was really good about keeping it clean and making sure that everything was good and doing the heparin and everything, so I never had complications with it. There are some people that have had issues, and it's like this open wound that goes directly to your bloodstream, so you can imagine you can get infections, you can go septic. There's a lot of different things, if you don't take care of it correctly, that can cause a lot of issues moving forward. So when they took it out, they kind of just make you a little drowsy, like some laughing gas type situation, and they literally just pull it out. I'm not sure how that works with the vein that it's connected to, but I think that they're able to go in and cauterize it on the inside to keep it from bleeding, yourself from bleeding out. So they pull it out and then they cauterize it, and then they let the area heal. As you saw, the scar is pretty minimal. It's like itty bitty dots basically, and I use Aquifer. If you ever have any sort of scars, Aquifer works amazing to apply to it. All my scars, even my leg scar, are like really, really faint and very flat. So obviously some people have issues with getting the like more bumpy scars and things like that. So I was good about, you need to massage your scars once they kind of heal, and then also use Aquifer or something to keep it from discoloring too much. The Port-A-Cath, they were able to put it in the right side that time, so this is 3 years later. It actually is like a triangle shaped, probably about that big piece that has tubing that again connects to your vena cava. It actually goes underneath the skin. You saw that scar that kind of goes along my collarbone, so they cut it open in that direction, open up the skin, and then insert Port-A-Cath into that area. They sew it up, entry area where you put the needle lives a little bit above where the suture might have been. It kind of sticks out. It sticks out probably like that much out of your skin. It doesn't seem like a lot, but it's kind of irritating. I always like could feel it, and I could feel it moving around and stuff. That wasn't really that fun. And it actually, it's kind of just loose in your skin. It's not like it's tied down to anything. So it would flip sometimes. It would flip the wrong way, and so you'd have to like push it to get it to be in the right spot in order to use it. It has 3 little bumps so that the nurses know where to insert the needle, and they have to use an actual needle to get to it because they have to pierce your skin. And there's like a little entry hole where the needle can go through, and then it'll access where the blood's coming out. You can use it for chemo treatments. You can't draw your own blood that way, so you have to use a needle and everything, and you have to know exactly how to do it. So that's kind of a bummer as well, is that you can't do that extra stuff. So it's not a huge plus in my opinion, unless you are really hard to stick. I probably would have rather just gotten an IV in my arm every time that I got chemo, and at that point I didn't do very many chemo treatments, so I don't think, for my instance, I don't feel like it was that worth it. And then having to go under both times in order to get it put in and taken out. The second time that I had cancer, I did go to the ER. I went to the ER the first time too. The ER nurses didn't know how to use it, and so it was like this whole thing, and I just felt really scared to have anyone use it if they didn't know, because there's like very specific way that you had to do it, and you had to do a certain amount of heparin, and it seemed like it was more heparin than normal, and it just seemed like a whole process that not everyone was super familiar with. You can take showers with it, you can take baths because it's under your skin and all that stuff, but again, I was doing chemo for less than 6 months, so I feel like it wasn't worth it. But if you have issues with being dehydrated, or your veins are super small, or you have a hard time getting stuck, or you don't like if you don't like needles, it still doesn't fix it, because now there's a needle like really close to your face going into your chest. So if you don't like needles, it's not going to help you either way. That is definitely a plus for people that have those issues. I personally didn't have any of those issues, so I would have rather just gotten stuck in my arm or my wrist. That one went smoothly. I didn't have a lung collapse or anything like that, and again, I had to get put under both times in order to get it put in and to be taken out. I don't really remember having very many issues with it. They had a disposable Picc line that they put in, and so it's like kind of similar to the other one where they have the tube sticking out, but it obviously is disposable, and you would want to dispose of it when you're done with chemotherapy as well. That is the Port-A-Cath. Recommend, if you're doing more than 6 months of chemo, to do one of the options. It might be less of a pain to not get stuck as much. Again, you still get stuck with the Port-A-Cath, so I'm not sure if, that's not really a plus for anything. So that's kind of the overview of Port-A-Caths and Picc lines. I hope that this was super interesting to everyone. If anyone has any questions about it, please put your questions in the comments below. I'm more than happy to give you not advice, but I can give you my experience. I can kind of give you the plus and minuses or whatever, but I am definitely not a doctor, so don't take all of my words for granted or anything like that. But I really want to be helpful and give all the information that people can possibly have. Thanks for listening to me, and I hope you guys enjoyed it, and don't forget to like and subscribe.